Thank you, and thank you for the videos. I think there are a few issues that come out of the videos that are really important to reflect as we think about health emergencies across the cycle, from preparedness to readiness to response. And the first thing is the dynamic social licensing that communities provide and keeps changing, right? We heard from speakers that initially the military was accepted and was trusted, and that licensing changed. So understanding that dynamic dimension of licensing seems to be really important. The other thing is the fact that these communities and individuals are rational agents, and they, as rational agents, they need to measure and make really tough decisions. We heard about the decision between quarantine or having access to crops, or quarantine or being able to mobilize fish to markets and provide for their families, and thinking about the social context, economic context of these outbreaks is fundamental. So mechanisms of community protection can be embedded in the response. I think the third thing is that epidemics do not happen in a vacuum. They exist, they happen in existing social structures. So we heard about the military in Uganda, and that is not an abnormality. It's the fact that the military is ubiquitous in that society. Think about the response in Portugal. Also, the military was involved. So each country, each social structure has its mechanisms of addressing issues, and it's very difficult in the heat of a situation to think about changing those. So we need to think about how do we work with these existing systems so we can adapt and localize them. And finally, issues of accountability, and that accountability goes at all levels, from global to sub-regional, right? Accountability of my neighbors, accountability of my leaders, political, religious, accountability of structures like the World Health Organization, World Bank, and so on. All this to say that the process of managing health emergencies is very dynamic, and we do need to understand context, and we need to bring data and evidence into our responses. And this is not evidence and data just for the sake of data, but with a very particular operational need. How can we adapt our operations to what the social dynamic systems are, how they are responding to these challenges? Thank you.